Good day, students. Welcome to CHIPS. You'll be seeing a different kind of a background behind me. And this is intended for charts and instruments in pathology for students and shall be forming part of the game. CHIPS, charts and instruments in pathology for students. The first instrument is the bone marrow aspiration needle. The importance of it is given in the enclosure. These instruments are not only for identification but can form a short note or a part of your viva voce. Therefore, it is pertinent that we know something about it. There are two needles on the screen. I would like you people to look at them for a second and then tell me the difference. In one needle, I am not finding this element. This is called the lateral adjustable guard. And both the needles, the names are the G.A.M.E needle and the Sala needle. Either of them are stout, that is, they are very thick because they are penetrating the bone. And also, there is one part of it called the stellate. This stellate will be seen in most of the needles, as we shall be discussing further. This is called the lateral adjustable guard. This is the stellate, and this is the needle as such. G.A.M.E and Sala, two types to remember. 4 S's, a mnemonic, short, sturdy, sharp, along with a stellate. If you look at the tip of the needle, this is called a wedge bevel type. It can cut through as well as penetrate. And this is the lateral adjustable guard. This will prevent some kind of an over penetration, and the physician or the surgeon will alter it according to the age of the patient and the thickness of the bone. What are the indications for bone marrow aspiration? There are 4 absolute indications. That is, these conditions we cannot diagnose without doing a bone marrow aspiration. They are aplastic anemia, ITP or idiopathic thrombocytopenic purpura, multiple myeloma, and megaloblastic anemia. All these conditions are purely bone marrow diagnosis. And this is the shape of the needle. The differences you people can see. The needle and the stellate. This is what I have been talking about repeatedly. The first one out is the needle, and this is a stellate which is within the needle. This has got a rounded tip. What happens whenever we penetrate any tissue? There will be a shearing force which is cutting and damaging the tissue. This is prevented by means of this round tip. So the stellate tip is rounded, it prevents damage during the penetration, and this has to be removed. Subsequently, I will be attaching a syringe for doing the aspiration. The lateral adjustable guard. The importance again I had mentioned, it can be altered according to the age of the patient and the thickness of the bone. It prevents over penetration. For example, if the manubrium sternae is a site, underlying that will be the great blood vessels as well as the heart. The damage to these structures can be prevented by means of this guard. And look at the stellate over here. This will be removed and a syringe will be attached and aspirate done. Aspiration must not be more than 0.2 to 0.3 ml. There are 5 complications for bone marrow aspiration. One is a over penetration, damage to the underlying vessels. Dry tap, it can be a technical error. Therefore, we will have to repeat the procedure. Hematoma formation, a blood clot, is not uncommon. Dilution, this is a very, very common error. Some physicians are over enthusiastic and they aspirate 1 to 2 ml. It is diluted with peripheral blood. Infection is a rare complication. That is why strict aseptic precautions are taken. The needle can be either reusable or disposable. Nowadays, we get good sets of disposable needles. The sites for doing a bone marrow aspiration are these. The first three I would like you people to kindly remember, and please give your answers in this order. The anterior superior iliac spine, posterior superior iliac spine, manubrium sterni, most common, and vertebrae and tibia are rarely used. This is a procedure over here. I think this picture will make us appreciate the very strict aseptic precaution that is being taken. Normally, there is an outer table and an inner table for the bone. Between this is the bone marrow. Whenever we try to pierce the bone, after some time, we find that there is a softening or a sense of yielding. That means our needle has reached the marrow, then we start the aspiration. Again, there are two things to remember. One is a bone marrow aspiration. Second one will be bone marrow biopsy. This is a G.A.M.E needle used for bone marrow biopsy. Whenever we want a pattern of a tissue to be made out, such as metastasis, etc., bone marrow biopsy is better. In myelofibrosis, again, there won't be any material, but when you do a biopsy, we can make a diagnosis. So pattern is the main indication for bone marrow biopsy. And the rest of it you people can see in my one page or any other text. See you in CHIPS 2.